YouTube, woo, y'all was about to be, I ain't know what the heck I was doing. I was like, okay, how do I do this? How do I do this? So, welcome everybody. Welcome Instagram. Welcome YouTube. We are going to have a time tonight. We are, okay, what's that? I'm getting a little feedback or whatever. I don't know what this is. I don't know what just happened, but hold on, y'all. Hello, hello, hello. I don't know what the hell because what I'm hearing is I'm hearing back talk. But anyway, so y'all, listen, we are going to have an amazing. Can y'all hear me? First of all, I want to make sure that my YouTube folks can hear me. Can y'all hear me? I need somebody to chime in and let me know y'all can hear me. Don't be laughing at me, Instagram, because I see y'all over there laughing while I'm struggling. Okay, y'all can hear me. Yes, yes, yes. All right, y'all. So it's gonna be on and popping. I told y'all this live is going to be a catch, y'all. I'm so mad that y'all didn't drop y'all dimes or y'all didn't questions or whatever because why? But anyway, so here's this. Yeah, let's talk. Let's talk. I do want to yeah, I am echoing. I don't know why. Maybe it's because y'all are too close. Oh, I'm so mad. Okay. See, my technical team, they be doing me dirty. Okay. I don't know what the echo is all about. But anyway, so all right, y'all. I hope it's not too distracting. I'm sitting here trying to figure it out. And if any of y'all know, don't be scared to say something because yeah, let me see if I can edit something. Is it something I need to be editing? Uh child, I don't know. But anyway, all right, y'all. So maybe mute something. What can I mute? Let me see. Okay. Well, I'm gonna have to take it off of mute, and I don't know what we're gonna do. We're gonna get it figured out somehow. Let me turn it down to something. Ooh, let me turn it down to something. I don't know. But anyway, y'all. Okay. So I hope y'all brought y'all drink. Now, y'all know if you know me, you know I don't drink. I don't like it. Um, but I don't drink. But I do have a little mocktail here. So this is Topo Chico lime. What is it? Mint, lime mint, Topo Chico lime mint, and it just has a little touch of that, what is it, dragon flower, dragon something, diet lemonade from, Chick-fil-A, baby, that thing is so strong and heavy, you need a chaser on her, like, it's for real, like, I'm like, "Well, damn, how sweet can it be?" But that's what I have, and, I'm always gonna have some cute little garnishments as like you're at the club, but this is my mocktail for the evening, so, um yeah, it's all the things. Okay, so everybody says I'm good now. I hope y'all can hear me. What I got going is going. I think my vol I think my volume was just a little bit too loud, but I hope y'all can hear me now. Okay, so somebody got their lemon water. That's what's up. All right, so y'all, tonight we're gonna talk about a whole bunch of stuff, and I want to know what y'all want to talk about because y'all know dragon fruit. I don't know, child. They have a new dragon fruit lemonade. Yes, it's only there till June. So go and try it. It was a little a little sweet, a little extra for me. But again, this is probably about 90% Topo Chico and about that much of the dragon fire, dragon fruit, dragon whatever it is, child. But it's good. So yeah, all right. So hey, watching from Canada. Meanwhile, I can't tell you when, but I will be in the good country of Canada within the next month or so. So let me know which province you're in. Let me know whether you're in Ontario, Montreal, Toronto. I would love to know because I need some good hangout spots and some good dinner spots where I'm going. All right, y'all. So with this live, I'm here, I'm on here. Life has been life, and over the past couple of weeks, I was just feeling terrible. I had a whole lot going on, but I mean terrible like physically. I was girl, kidney stone, not drinking no water, ripping and running, doing all the things. And honey, it life grabbed me up and was like, girl, sit on down somewhere. I'm Ontario. Maybe that'll be the next leg of the tour. I'm going to Toronto this time. But anyway, so, I just wanted to jump on here, and y'all know I drop my videos and I drop my, my, podcast and all, and I try to get to as many comments as I can, but, sometimes it's like I'll double back for like a day or so, or a couple of days, but I can't really, continue to double back. And that sucks sometimes because it's a city in Ontario. So oh, okay. See, look at me. I'm ignorant. I'm ignorant. Sis, make sure I know where I should be shopping. Make sure I know where I should be eating. Good food, good cuisine, all the things. Just make sure I know where I should be eating, Miss Chanel. Let me know what's happening with your city. Um, and I'll be visiting other places as well. So I just see a lot of stuff, and I can't get back to all of it. I do see a lot of questions. A lot of people are having questions about the bioidentical hormone replacement, and we're going to touch on that a little bit. You guys always have questions about herpes. And I want to know specifically what's the question. And don't be embarrassed to leave the question, because at the end of the day, because you have a question doesn't mean you're herpes positive. And like I said, if you are herpes positive, honey, it's a huge population that's right there with you. So ain't nobody better than nobody else. So if you got a question and you want to ask the question, then make sure you're asking the question. Okay. So there's that. All right. And that's that. So that's that on that, y'all. Let me line y'all up a little bit better so it don't look like I'm looking in 15 different directions, looking all crazy. Um, but yeah, so I want to hit the bioidentical hormone stuff, because all my perimenopausal sisters and menopausal sisters and all the things, and I'm getting reports that I'm getting a lot of people are getting a lot of ignorant comments, a lot of negative comments, and dismissive comments from their doctors about it. And we can talk about that. Okay. Um, yeah, we always have soap, girl. We always have soap. Somebody said, "Do I have more soap?" Girl, we always got soap. I be in the lab. I be in that thing like it's the Carter. Okay, y'all. If y'all my age, y'all remember New Jack City. Y'all remember the Carter. We always have soap, but sometimes it's like it's all over the place so much that we can't. We don't. By the time it's time to stock it in the office, that thing is. But we always have soap, and you can do a local pickup, and obviously we ship out too. So that answered that question. I'm so glad you love your cleaning tube, girl. So glad. People that's diagnosed with HSV1 and relationships. Yeah, okay, we'll talk about HSV1 because y'all be stressing about this HSV1, and I don't want to do that now. I do not want y'all to be. I don't even want you to be stressed out about HSV2, but I damn sure don't want you to be stressed out about HSV1. And menopause seems like it is a huge, huge topic. And I'm gonna go over it again. I've done a podcast on it where I had a conversation about it, and I talked about bioidentical hormone replacement. But I'm gonna do it again because with Instagram and YouTube, and I want to tell you guys, when you are watching, if you are watching, you see a video, please share it, because Instagram is doing some weird stuff. Like y'all see a fight in Walmart, 32 million people see that, but when it's something productive, and trying to teach people what something, especially women of color, they will not boost it, they will not push it, they will not. So please, if you see a video, you agree with the video, you love the video, whatever the case may be, go ahead on and just share it, okay, with your fam, or whatever on your stories, however it goes. Okay. Now, let's talk about. I'm gonna go through the whole menopause talk for real, because it's a thing, right? And I think that the reality is, and I'm always like, I hate when people come in and like, well, on TikTok, well, on YouTube, and I get pissed, right? But do I really have a right to be pissed in that you have so many providers who either give you limited information, they give you information you don't understand. I'm coming across a lot of them who don't understand it the damn selves. And you're like you're in need to find something else, right? And the reality of that is, unfortunately, you're going to go to a social media platform because, again, back in the day, it was encyclopedia and it was, library or books or articles. Now it's social media. Um, and let's just get into it. And I'm going to break it down for you completely. Okay. And I'm going to break down the symptoms of it, and I'm going to break down the benefit, hormone replacement, the differences in hormone replacement, and I'm going to break down the benefits of hormone replacement. And I'll also talk about the risks, okay? Depending on what the situation is. And I'll tell you, I do bioidentical hormone replacement in my practice. I only do bioidentical hormone replacement in my practice. And, my patients are in love, okay? I love it, all right? So I'm going to break that all down for you. And then I'm going to give you the name of the bioidentical hormone company that I use, because you have to go through a company and, these calculations go through the company. And the company has a website, and wherever you live, you can go on that website and find a provider who has been certified by the company to put bioidentical hormone pellets in. And not only that, they'll be able to educate you more. They'll be able to say, yes, this is what you need. Now, I ain't gonna lie, a lot of these doctors' offices, they do be money grabbing. So they be like, oh, you need this supplement, you need this supplement, you need. I'm not a supplement. It's not. I'm not saying that they don't work. That's not what I'm saying about the supplements that the company sells. I'm just saying I never do anything for my patients that I don't do for myself. And I'm not good with the whole taking something every day thing. I know I should be, but I'm not. And so I haven't tested out a lot of these supplements. And these things are like $80 a bottle. So I'm not about to sell you 3 or 4 bottles of something that you're going to need every month, or you're going to, once you start taking it, you're taking it, that you're going to be taking every month. And I'm not even sure if it works. Like, I know what the bioidentical hormones do, but do I feel like you need to specifically be taking their vitamins over a 1-a-day Centrum? No. So I'm not going to push it. But a lot of these doctors, you need this, you need this, you need this, and it runs up your total. So all I'm saying is that I ain't saying you got to do all that, but I will be able to put you to the website. I will be able to put you to the website that has the approved providers who can actually place your hormone pellets in and have information about it and all that you need to understand about it. Okay. So let's get started talking about menopause in general. And I'm going to kind of, I'm going to tell you everything. Somebody just asked about ashwagandha and menopausal symptoms. Well, so here's this, if your symptoms, your menopausal symptoms are due to hormone imbalances, ashwagandha is not a hormone. Now, I'm not saying that it doesn't help some of the symptoms. I'm sure it probably does because of its effects. It's kind of like a sedative, kind of chill mode kind of a situation. Now, that's old thinking. And that is so funny when you would go to your doctor and you were menopausal back in the day, it would be like, oh, I don't want to have sex with my husband. And they would give you an antidepressant. Heffa, oh, thank you so much. I appreciate you, Miss Shirley. Um, Heffa, first and foremost, ain't nobody said I was depressed. I said I didn't want to have sex with my husband. That ain't depression. But again, they have all these different stuffs for men. They only have one pill for women, which you can't take with wine. You can't take with this. You can't take if you child. It's just too much. So let me just talk to you all about menopause in general. Y'all ready for this? And this will be saved. So if you can always go back and review it. Now, you have heard so many different terms, and the terms are interchangeable, kind of, right? But let's talk about this. We have perimenopause, right? And then we have postmenopause, and then we have menopause. Now, let me explain the difference. Peri is peri. The word peri means around, okay? It just means around menopause. So when we talk about perimenopause, postmenopause, and menopause, that's with respect to your bleeding. That's with respect to the bleeding. And why is that? Because if you're perimenopausal, that means you have not been without a period for more than 12 months, or for at least 12 months. You have not. right? So when you are perimenopausal, that means your periods are skipping. You may have not seen it for 8 months. You may not seen it for 10 months. And then boom, you have a period. You're perimenopausal. If you may have one every other month, you may have one twice a month, you're perimenopausal. But that means you have not gone 12 straight months without a period. You have not. Okay. So if you have not gone 12 straight months, we'll deal with hysterectomy stuff in a minute. Give me a second. You have not gone through 12 straight months without a period. You are perimenopausal. That's your pocket right there. Okay. We're not talking about symptoms. We're not talking about nothing but bleeding, because that's what determines what pocket you're in. Right now, menopause. Y'all ready for this? Y'all ready for this? Menopause is one day. Menopause is an anniversary day. It's an anniversary day. I know, clutch your pearls, clutch your pearls. But menopause is one day. Okay. And what does that mean? It means that the day that you have been without that period for 12 straight months, the day that you have been without it for 12 straight months, that is your menopause day. The day after that, you're postmenopausal. Ain't that crazy? Now, again, here's the gag. Once you are postmenopausal, you should never, ever, ever see a period again. If you see a period and you're postmenopausal, y'all ready for this? It is endometrial cancer until proven otherwise. Now, let me jump on the proven otherwise part. I'm going to need y'all to back up off of me. Give me some grace. And the proven otherwise part means you go to your doctor and be like, listen, I ain't had a period in 18 months. Now here go your girl. I was at the wedding. I was minding my business. And then here come your girl. Okay. Here come your girl. Then the doctors to say, okay, I need to get an ultrasound and I need to do an endometrial biopsy. Now, this is somebody who's not on hormones. This is like, no, you're not doing hormone replacement. You're not doing anything. You just minding your business out here. You're not on nothing. You haven't had a period for 16, 13 months, 14 months, 15 months. I don't care. Then all of a sudden, boom, you bleeding. You can't be like, ooh, child, I had a period out of where? Nowhere. No, ma'am. No, ma'am. That thing wasn't out of nowhere. And we're going to find out where she was out of. No, ma'am. So that needs to be an ultrasound. That needs to be an endometrial biopsy. And then if it says, oh, your lining was too thin or your lining thickened up for some reason, then we start to look for some things. But you should never see a period after you haven't seen one for 12 months. Okay, so that is how you get you like, I want to know if I'm perimenopausal. Are you still having a period? Yes, we can perimenopausal. So, the terms now, and that is just with respect to bleeding. Okay. Now, here's why it's not really important. Only with respect to bleeding, though, because we need to know whether we need to be testing you for, the cancer or whatever, because of postmenopause. Like once you're postmenopausal, that's why that's important, right? But when we deal with your symptoms, the symptoms are the same, and I call it menopausal syndrome, right? I don't care whether you're perimenopausal, menopausal, postmenopausal, the symptoms are the same. And I want to, let me just get this, because I want to drop some game on y'all that it be driving me crazy. Not only with y'all, not only people come to see the office to see me, my patients already know. Here's a lot of times, I don't know whether it be y'all providers that be doing this or whether we be trying to money grab. I don't know what the heck. But let me just let you know something. When you do hormone labs, people say, I want to check my hormones. I'll be like, check them for what? And I literally want to know. Well, I want to know if I'm perimenopausal. Are you skipping periods? Yes. Do you have symptoms? Yes, you're perimenopausal. Your labs are very black and white when it comes to menopause, right? We usually check your estradiol, your FSH, your LH, and your testosterone, whatever. But the point is that, hear this, your labs are either going to tell you you're menopausal or you're not. That's all they tell you. Right? So people are like, well, I want to know what my labs look like. What does that even mean? I want to know my perimenopausal. Your labs are not going to tell you whether you're perimenopausal. Your symptoms are going to tell you. Okay. So don't get, it's either going to tell you either you're menopausal or you're not. Now, this is very important for women who have had hysterectomies, because you may have symptoms. You may be like, well, am I menopausal? Like, am I like, and again, it's only important for bleeding purposes if you still have a uterus, because we're chasing after make sure you don't have uterine cancer, right? So at the end of the day, it's really not important if you say to me, I have menopausal syndromes, because people be like, well, I want to know how far into menopause I am. That's not a thing. Like, it's not a thing. The treatment is the same. Okay. So let's talk about some of the symptoms. Now, when it comes to menopause, okay, and we use these labs, at least when you do bioidentical hormones, we use these labs to determine whether or not, what dose of hormone you have. But, you know, when it comes to menopausal symptoms, you may have some of the symptoms, you may have all of the symptoms, you may have a few symptoms, you may have very severe symptoms, you may have like I have hot flashes. When I'm because I'm always late for my pellets. Like, I be so busy. I'm supposed to go about 4 months, honey. I be 6.5 months, and I'm like, why am I so hot? And I'll be like, damn, I need some pellets. But anyway, you may have really, really severe symptoms, right? Um, but you may have light symptoms. Please don't think that whatever your mom had, you're gonna have. Like, my mom was like, I think I had a hot flash or two. I think. And I will get very, very warm, and I will start to beat up a little bit. Like, my edges will get wavy on a sister, and I'll start beating up a little bit, but I'm not the girl with the pouring sweat. But that doesn't, so your symptoms can vary, right? But let's talk about them. The first one we want to talk about is temperature dysregulation. So hot flashes and night sweats are two different things. Your hot sweats are when you're minding your business and it seemed like a dragon just opened their mouth on the back of your neck. And you don't know whether it's going to go from the head to the feet or the feet to the head. But baby, you know you're hot. You're hot up under that bra. You're sweating. You might be dripping something down that chest. You're hot, okay, for no good reason. Night sweats are different. Night sweats are one leg over the cover, one leg under the cover, one leg over the cover, one leg under the cover. That's your hot sweats. That's where you at with that. You don't get comfortable until it's almost time to wake up in the morning. Crazy. Then we have temperature dysregulation. Then you have fatigue. It's just, you just feel tired, just tired for no reason. You can't get motivated. You just feel dragged down. You feel like it's 100-pound anchor on your back. So you have fatigue. You have that midsection. I don't necessarily know why they call it menno belly, but we can go with menno belly. That's cute. We'll talk about that midsection a little bit later, but you have that midsection that all of a sudden she done popped up on a girl and you just like, why can't I get rid of her? I've been doing crunches. I've been doing this. Why can't I get rid of her all of a sudden? We'll talk about that. So you have the weight gain and the inability to lose weight, you have fatigue, you have temperature dysregulation. Now, when people say moody, I think in people's mind back in the day, it's like, it's like, "Ugh," and that's not really what it is. And some people it is, but it's more like a loss of patience. It's more like not really giving people grace. It's kind of like you're not really listening. You like, child, I don't care. Or, it's just, just negative, just cup half empty type of space. Your anxiety increases. Sometimes the depression increases. Brain fog. What did I walk into this room for? You saw me, but like, let me write this down before I forget. Type of a thing. You be like, damn, what were we talking about? You're like, I walked in here for something. Brain fog. But that can go with a lot of different things, but certainly with menopause. And then loss of libido is like you don't want to have sex. You don't used to be like, I used to be about that life. Now you like, not so much. I don't care if he don't touch me, and I prefer for him not to. And I'd be like, oh Lord, here he come. And then we have vaginal dryness. Yeah, so I say it takes longer to get cranked up. And then when you get cranked up, it ain't crank to crank like it used to be all Niagara Falls. Now, I mean, but it ain't like it used to be. Now, I'm gonna tell y'all my recommendations on fixing all of that. But those are your symptoms, and that is what you're going to see. Now, some people are like, "Oh, my hair is getting a little thin, or my hair is coming out." At the top, mine too, honey. It's a struggle. Get my hair cut tomorrow, by the way, y'all. I'm so excited. I can't wait to show y'all because I'm real funny about my hair. Because I ain't the girl that be hiding stuff on my face. No, because this face card does not decline. So I'm real funny about my hair, but I love my stylist. She's super sweet. She's super talented. And I don't know if she's gonna let me show her from the salon. But anyway, so let's not digress. Y'all know my conversations be all over the place. So when it comes to menopausal syndrome, which again, it doesn't matter whether you're perimenopausal, whether you're on that day of menopause, or you're postmenopausal, the symptoms are the symptoms, the treatment is the treatment. Okay. Now, I'm going to tell you guys the differences in hormone stuff because somebody sent me something about some testosterone and the low testosterone. Okay. Let's talk about it a little bit. You have two arms when it comes to hormone replacement. Okay. Um, you have the synthetic arm, and then you have the bioidentical arm. I'm on the bioidentical side, but let's talk about the synthetic side. I like to explain everything to everybody, and then you make the decision that's best for your life, right? So when it comes to synthetic hormone replacement, that's going to be your creams, your patches, your pills. That's generally what those things are. A lot of times it's estrogen and progesterone. Very seldom is it testosterone, but it can be. Okay, so the thing about synthetic hormone replacement, it's very generic, right? It's a generic type of a thing. And also what happens with synthetic hormone replacement, so the way things go is if anything is made in nature, you cannot patent anything made in nature because it's in nature. Okay. um so the thing is that drug companies or big pharma could not make money off of it. They couldn't make a lot of money off of it because you can't patent. You can't patent it. You can't own it. Okay. So what they said is, okay, well, we're going to get these hormones and we're going to tweak them a little bit. And if we tweak them, that obviously makes them synthetic. It makes them synthetic just basically means man-made. So we're going to tweak it. We're going to make it synthetic, and then we're going to patent it. And that's what they did. And so anytime you make something synthetic, anytime that something goes into the human body that is a man-made thing or a synthetic thing, depending on when we're dealing with hormones, especially, we have to think about and consider that it's going to increase your risk of cancer. And it's not a significant risk, to be perfectly honest. They did a study, I think it was like the Framingham study, and it showed they had like a very elderly lady who was on the maximum dose of hormone replacement for a very long time, and she developed breast cancer. So then they went crazy and was like, oh, hormone replacement causes breast cancer and well, we know that as a woman, your lifetime risk of having breast cancer is 15%. Okay. Well, we found that the hormones and the synthetic hormone replacement increased it to about 18%, which statistically is insignificant, but people grabbed hold, ran with it. And then if you have a strong family history, you don't even want that 3%, right? And again, the study was kind of like, because the lady was like 80 years old. And we know that one of the number one risk factors for breast cancer is age. So it's like, was it the hormones for all those years, which I don't agree with that treatment, but was it the hormone for all those years, or was it the age, or what do we got going on here? So the study was very, very flawed, but it was something that the news could kind of sink their teeth in and say, hormone replacement causes cancer. And that's all women needed to hear. They weren't really well versed on what it was doing anyway. It was taking away their their hot sweats, but it wasn't really doing anything else. They still had dry vagina. They still didn't want to have sex. They still were cranky. And so they were like, you know what? I can deal with the hot flashes. If I don't have to get cancer, I'm good. And that's kind of how it went. That's kind of how it went, right? But the women who were on it and were taking it, they be paying $200, $300, $400 a month, right, for hormone replacement. So there was a group of healthcare providers, probably about bioidenticals have probably been out for a good 20 years, a good 20 years. It's not as new as you would think, right? So they said, okay, well, what we're going to do is we're going to look at what women want. Women want solutions. Women want not to feel like this. Women want all of their problems to be solved. And they don't want to have a risk of cancer. So if we don't synthesize it. We don't change it. We use it as it is in nature. No, we can't patent it. But if you stop and think about it, if you got 50 women over here and you charging them $1 million, what if I got 1 million women and I charge them $50? We still got the same amount of money, and I'm doing well for the patient. Actually, bioidentical hormones actually decrease your risk of cancer, because what it's doing is it's only replacing what your body already makes. So if you need estrogen, everybody who takes it does not need estrogen. So if you need estrogen, if you take estrogen, then it gives you the kind of estrogen your body makes, which is called estradiol. So it's not giving you a synthetic form or a different form. It's giving you the kind that your body makes. Most people, almost all, actually 100% of people, interestingly enough, when you do the bioidentical hormones, what you're really going to get is testosterone. That's that girl. Testosterone is that girl, honey. That's what you're going to get, the testosterone. And then possibly progesterone, depending on, whether you have a hysterectomy or not, whether you are on estrogen or not, all the things. But the progesterone is oral. So you kind of take it every night and it kind of makes you feel like woozy. So it's kind of like a sleeping pill. It helps you get better rest, and it's going to help with that brain fog. So that is how, with the bioidenticals, we draw your blood. And some people always say, what my blood show? I'd be like, I don't know. Because I don't the numbers are there, but it means something to the equation, but I didn't create the equation. The company created the equation. So we draw your blood. And then I look at these things like your BMI, how active you are, what symptoms you have. Have you had a hysterectomy? Are you a chronic pain patient? Are you currently on some type of hormone? All the things. And I put that information into the computer, and then it spits out. It says, yes, she needs this much estrogen. She needs this much testosterone, and she needs this much progesterone. Right? Or whatever your formula is, just testosterone, whatever the case may be. So if you're somebody who says, hey, I had endometriosis early on in life, I'd be like, maybe let's forego the estrogen so that we don't spark up anything and you start to have pain again. Right? So it really is based on you, your life, your symptoms. Now people say, now what could happen because I'm taking all this testosterone? Am I going to grow a beard? Child. We just replacing what has diminished in you, because over the years, your hormones go from here, and over the years, they come down. And we figure the company, basically the logic is, it's not that you're getting older, you're getting sicker. It's because your hormones are diminishing that you're getting sicker. And so what we do is we just replace those hormones. So the testosterone, we're bringing you up to the level where you would optimally function. And so nobody grows a beard, any of those things. Now, you probably already in the life where you plucking 1 or 2 here, won't we all? But you shouldn't be like, girl, I'm shaving now. No. Okay. But if you like, child, I might be plucking, a little bit more frequently. You tell me that. And then I'm going to put that in the computer and be like, she has excessive hair growth. And then it's going to drop your dose one. So it's always going to be literally perfect for you. Okay. And you guys saw the video. If you haven't seen it, go on my Instagram and look at it, where you actually see me placing the pellets. I numb up your butt. That's the only part, for like maybe 7 seconds. You feel a pinch, you feel a burn. Once that thing is numb, it's numb. You don't feel anything else. The pellets it can look like a dot. It can be the size of a piece of rice. It can be, so they're narrow like rice. Sometimes they're a little bit thicker, but they're the consistency of like chalk. It's embedded in wild yam root. And wild yam root actually is an herb that also helps with hot flashes, right? So it's that girl. I'm just letting you know, you have to do it 2 or 3 times a year. So it's every 4 to 6 months. Now, that's why I was saying I'm always late with mine. So the more active you are, you're going to be closer to like 4 months. Like if you go to the gym, you play pickleball, you line dance, you this, you that, because it's based on cardiac output. So what happens is the more activity you have, the faster the hormones get used up. If you kind of got a sedentary lifestyle, like you might go to the gym a couple of times a week, you might walk up the stairs on a daily basis if you should so choose. More of a sedentary lifestyle, you'll probably be closer to 6 months. Everybody knows, when it's time for your pellets, you start to feel tired again like you were. You start to have hot flashes again, and you start to be like, child, I hope that man do not come. Then you be like, I need my pellets. I need my pellets. But it does great for you because it actually decreases your risk of cancers. It helps with bone density and bone mass. It helps with cardiovascular events. It doesn't per se make you lose weight, but what it does is it makes your body recognize what you're doing at the gym. So if you're watching what you eat, you're going to the gym, you're walking, you like, child, I'm doing all this and I done gained a pound this month. You'll see that start to reverse. You'll start to see, oh, okay, I'm losing weight again. Oh, okay. That type of a thing. It makes you feel amazing. So your spirit just feels calm. Like you feel like you want to give people grace. You really don't want to argue. You're like, child, I ain't finna argue. I'm not fitting to squabble with this foolishness. So you start to truly see the cup as half full. Your anxiety diminishes and goes away. The temperature issue, even if you're not taking estrogen, the testosterone still helps with the hot flashes and it goes away. It's just, and as far as your sex drive, let me tell you something. I don't tell people business. That's not what I do. These pellets have you wanting to have sex with his man, her man, the FedEx man, the public sub man, the UPS man. You be wanting to be like, psst, come here. Like, it's a whole situation. I'm just letting you know. As far as being wet, you're like, wait, do I have discharge? Did I pee on myself? Am I wet? Like all of a sudden you kind of just like wet again. Like it's just like, what is happening? All you really want to do is just have sex. And it's very interesting because my patients kind of explain it even as like um when you orgasm, it's like you want to have sex all over again. Like you never orgasmed at all. So the more sex you have, the hornier you get. I had husbands come in like, I'm gonna need you to ratchet this down some because I ain't agree to 5 or 7 times a night and I'm not doing that. I got to work. Hey, deal with that at the house. Deal with that at the house. I had my patients say, I ain't got time for him going to get a rose. One of my patients called me and said, honey, I think I done broke my clitoris. It don't work no more. I don't think I'm if I ain't having sex, I'm sitting in the car with the rules. I'm like, Lord Jesus. I got the early senior citizens joining the swingers club. Baby, let me tell you what. These people done getting their lives, they out in the streets. And like I said, baby, as long as everybody's safe and everybody happy, everybody grown. Everybody is grown. But it changes your life. It really, really does. Now, let me tell you something. Okay. If your issue is hormonal, it's going to help you. If you hate your husband, if sex has never been your thing, if you don't like it for some reason, you have some unhealed traumas, you don't like the person you with, you think his sex is absolutely horrible, it is not going to help you. Okay. This is a hormonal thing. I'm just saying. All right. Great. Because people like, it didn't help me. But yeah, I can't stand him. We can't, this ain't a relationship fixer. Okay. This is a libido fixer. Let me be clear. All right. Now, yes, honey, it's a whole thing. So it's all the things. Like I said, it's one of those things that people can tell you everything in the world until you experience it, and then you be like, I didn't know I was living like that. I didn't know I was that miserable. Sign me up. Yes, pellet me immediately. It's so funny because some days, like I feel like a dope dealer because my patients be like, is it time for my pellets yet? You was just here a month and a half ago, weren't you? No, I just feel like I don't know, like I just need something. Like girl, like I'm out here, I be feeling like I'm peddling dope, y'all. But it is an amazing life. So the company that I use, get a pen, y'all. Get a pen because there's a couple of companies out there, and just get a pen. Get a pen. So the name of my pellet company is Avexapel. So it's EVEXIPEL. Let me tell y'all something. Y'all to pin this. I don't know how to do all that. I don't know. Listen, it was hard enough for me to get 2 platforms going. I don't know how to pin a thing. One of y'all can pin it if you know how. But it's EVEXIPEL. So if you go to avexapel.com, you'll see something like find a provider in my area. Now, if you're driving distance to me, if you like Tennessee, Alabama, you somewhere in Georgia, come on down, girl. Now, let me just say this, y'all, before my office manager skins the back of my neck. We are not currently accepting new patients. I'm only accepting pellet patients, PCOS patients, and metabolism management, aka weight management patients. But patients who are coming in just for like GYN exams, annual exams, I'm not accepting any new that's not already on my schedule. Okay. But for all my patients who are my patients, I'm still doing y'all stuff. Now, let me be clear. If you are a new patient, because we've had some problems, and let me get here with y'all. If you are a new patient and you are a no call, no show, you have been flagged and you will never be able to schedule an appointment again because we have a huge waiting list. And at the end of the day, somebody else could have been on that wait. Somebody else could have been in the office because you decided to do the no call, no show. Stop playing on my schedule. So you will be flagged. Boom, there you go. Now, so that's that. I hope y'all got it. I hope you understand. Somebody was asking me something about, oh, my testosterone levels were low. Well, okay. What does that mean? It's not about, and I think a lot of times, just like, when people do blood work, right? And then it's just like, oh, your potassium is low. Yeah, we want to fix that. Oh, your iron is low. We want to fix that. But there are some things that are going to fluctuate, and there are some things that are okay, that we're worried about the symptom, not the actual number. Okay. So yeah, don't, if it doesn't mean, if somebody says your my testosterone is low, say, well, what does that mean in context? Give me the context of that. Like, tell me what that actually means for my health. And when they start to get confused, then that's a red flag. Now, I see that a lot of doctors, for whatever reason, they are not doing bioidentical hormone, which that's their choice. That's their choice. There's sound science behind this. I don't play anything. I did pellets for 3 to 6 months before I even thought about introducing it to my patients. I got to know. I want to know. I read the articles. I read all the articles. I read all the things. Okay. Um, and it is doesn't coincide. It doesn't. There's no medical condition in which you can't have it. Side effects are really those, like, think like the only side effects which I haven't actually seen. They say that what is it? No, fluid retention. Now that you may gain 2 pounds after the first dose only. I haven't seen it, so that means that patients didn't notice it. And I didn't notice it with myself because I don't play about this weight situation, girl. But they say after the first dose only, you have fluid retention of 2 pounds, but then it resolves and goes away. It doesn't stay, obviously. You could have swelling of the hands or feet, like your rings feel tight. Again, I've never seen that. They say it happens in super hot temperatures. The company is based in Texas. So apparently, maybe they see it a lot, but I haven't seen it. Uterine spotting or bleeding, that's if you have a uterus and only if you're getting estrogen. But a lot of times people will forget to take their progesterone because estrogen and progesterone are like on a seesaw. So if you take one, you have to take the other, right? And some people are like, child, I forgot to take it for 2 or 3 days. Yeah, you're going to start spotting. You're going to start spotting. Yeah, you're going to start bleeding. So if you're saying I ain't going to take the progesterone, then tell me and I won't give you the estrogen. Okay? Because it's going to happen. Anybody just taking testosterone, it don't matter for you. And then obviously like acne, hair growth, hair thinning. I truly believe that comes from, because some of the doctors. Now I see somebody say, "Great, I'm in Texas." It don't mean you're gonna have it, but I'm just saying maybe that's why they say they see it. They see it in warmer temperatures. I've never seen it, but like as far as like acne is concerned, like if you suffer with adult acne, and then you get your pellets. You may get a pimple here, a pimple here. If so, tell me, and I'll put that in the computer, and then boom, it drops you a dose. Now, I don't know what I was going through. I had went through this time period where my skin, I think when I'm stressed, my skin gets crazy. And then I had pimples and hyperpigmentation. It was just a mess, girl. But for my pellets, the testosterone does nothing. You see, I might have a pimple. Where I got a pimple? Might have a pimple here, but those are small pimples and it's just not because of pellet stuff. So, those things come with a grain of sand. Whenever you do something, take Tylenol, anything else, they got to tell you everything. Because if you like, I got a headache and y'all ain't telling me I got a headache, I could get a headache, I'm suing, that type of thing. But I've really never seen any untoward issues. One of my patients was allergic to like the surges, what is the steri strips that I put on. So she got like a little rash around her incision site because she was allergic to the little skin tape. But that's for the most part it. I haven't really seen anything crazy. And I haven't experienced anything crazy. So that's that. So now you guys know. Got it? Okay. So you don't have to have anybody explain it to you. You know the difference in perimenopause, menopause, postmenopause. You know what menopausal syndrome is. You know the difference in synthetic hormone replacement and bioidentical hormone replacement. And you decide what's best for your life. So now, do they have specific doses with synthetic? No. What we're supposed to do is we're supposed to start low and go slow. So you're supposed to start people on the lowest dose of hormone and then bring them back in a month. And they'll be like, did you see any results? If they like, nope, okay, let's go up. Did you see any results? Nope, okay, let's go up. That's how the synthetic works. Whereas the bioidentical is like, okay, bam, this is exactly what you need. Period. So there's that. Now, another thing somebody asked me about was HSV1 and being in a relationship. Child. So first of all, let me be very clear. I I don't really even check for HSV1 in my practice. Oh, the price, my expert price. Oh, yes, child, it's about 410, 420. But again, that's 2 or 3 times a year. No insurance doesn't cover it, but if you got an HSA card, you can use that. Okay. All right, then. So now, the HSV1. First of all, HSV1 versus HSV2, what is basically like the whole thought is HSV2 is genital herpes. HSV1 is going to be oral. Now, I'm not big on checking for HSV1 because, baby, first of all, the crap load of people have HSV2 in general. But as far as HSV1, child, you can have that at 5 or 6 years old, putting toys in one's mouth at the daycare center, all types of kissing a herpetic boyfriend in the 4th grade that you didn't realize that was it. I don't really get into it. People say, well, you can have HSV1 down below. Right. But if it's HSV1 and it's down below, it's still gonna function the same as HSV2. Does that make sense? So I'm not big on HSV1 diagnosis. Child, I don't care. Like, you got an ulcer in your mouth or something like that. I hope it ain't syphilis. I ain't worried about damn HSV1. Do you got syphilis? Okay. But I'm being malicious, but well, I'm being facetious, not malicious. But if you have a fever blister on your lip, technically it's gonna be HSV1. Okay. What are we going to do about it? Nothing. Get some of that Abreva cream to help the burn or to help the sting or whatever it is, and child, move on. And that's pretty much it. I wouldn't even say that that's too much of a thing. I don't want to disregard anybody's thoughts, feelings, or concerns, but that's not really too much of a thing. So all right, y'all. I want to talk to y'all about a couple of things. What are the symptoms for menopause? Child, I just did the whole rundown. Did you join late? You're gonna have to go back and watch it. Because I just did the whole thing for menopause. Bada boom, bada bing. If you've been asymptomatic for about 2 years, does your risk of transmission go down for HSV2? Does the contagiousness decrease? That's a great question, and the answer is no. If you have it, you have it. It is what it is. People with a healthy immune system generally will not see outbreaks. You may see 1 or 2 a year. You may have your initial outbreak and never see another one. But the reality of the situation is people think that if you have herpes, you're going to give herpes to every person you have sex with. That is not true. When it comes to herpes, the rate of transmission is only 5%. Now, if you have sex during an outbreak, it's a little bit higher. It's about 15%. But technically, that's still low. Okay, technical. Oh, you just joined. Oh, girl. Well, it was a whole talk, but it's gonna be recorded, so don't worry about it. You'll be able to go back and get the whole breakdown, get your pen and everything. We had class, girl. But it's only 15%, so it's not like, oh, every person I have sex with, they're gonna come back to me next week and be like, you gave me herpes. No, and to be perfectly honest, can I say something without y'all feeling the type of way? Can I say something to my good girlfriends? And hopefully I got some bros watching too. As much, and I get it with the stigma, and I get it with you don't want somebody to be able to point a finger at you, and you don't want somebody to be able to like, she did. I get it. But can I say this? As much energy as y'all put in to not wanting, being afraid of, and being cautious of transmitting herpes, I need y'all to put a third of that energy into figuring out whether the person you're sleeping with has herpes before you sleep with them. I need y'all to be dogmatic and be like, so you got some numbers for me? Can you run me some numbers? Like, what's up? What's up? Because what I see a lot of is women falling on a sword. I see y'all falling. Well, I just felt like I wanted to have a conversation and have full disclosure. I feel that in my soul, sis. Did you ask him if he had herpes? Did you see any testing? Mm-mm. So you wanted to sit and have a whole conversation about your herpes, and you don't even know whether he got HIV. All right, then. And so a lot of times, and it's like, well, I just feel like I should be honest. Okay, that's your business. Be honest all you want, but is honesty a two-way street or no? And then here's my thing. Then when you get into a fight, because I don't want anybody to feel like, well, I don't deserve to ask to see his stuff because I have herpes. What? And if you do, just simply tell your doctor, I want you to test me for everything, but I know I have herpes and I'm not paying for a test that I know going to be positive. So check for everything. You don't need to check for that. So if you want to talk about it on your own terms, at least you can get tested. You can show your test. You can show your numbers without disclosing what you don't want to disclose. And then still be like, okay, but where your information at, bro? Okay. So now you see somebody and their herpes testing is negative, then that's when you can say, okay, let me sit and have a mature conversation and say, listen, this is what this is, this is what it means, this is what we doing over. And then you give somebody a choice in whether they want to be involved or not. But y'all are falling on us. We're like, oh baby, stay with me because I got this. Child, you don't know what they got. We ain't doing it. We ain't doing it. So I just wanted to put that out there because somebody had asked about HSV1. So this is a good question. Somebody who just joined, but that's cute. She was like, she wants to know where HPV comes from. So that's very, very cool. HPV is short for human papillomavirus. And human papillomavirus technically, and I'm gonna tell you, because I think a lot of times, and I'm gonna keep it a buck, I think a lot of times that doctors explain stuff to people in a way that I think they mean to be intimidating, and sometimes I think they mean to be jerks. I'm sorry, I just feel like that. The way I explain HPV, I usually will say is sexually associated. Because when we think sexually transmitted, we think gonorrhea, chlamydia, trichomonas, like who done gave me the what? Well, obviously getting HPV is in semen. Okay. And so you can bust down and have all the sex in the world, but if it's protected and you are using condoms, you're going to be HPV negative every time. But if you are not, and you're like, well, I'm having sex with the same person, it does not matter. One, you're not sure that that's the only person that you're the only person. Yes, you can have herpes your whole life and not know it. For the person who just asked. But anyway, so you could be busting down with one person, don't mean he's only busting down or she's only busting down with you. And then that person also could have very much had a past. So, it's one of those things where I say that it's sexually associated because I don't like for people to have a negative connotation about it. Unfortunately, 90% of the population is positive for HPV. Some people will clear it. Some people's immune system will clear it. But if you haven't cleared it by age 31, you're not going to clear it. Okay. Now, who cares if you have HPV? Let me put it to you like that. Who cares? The thing is that we don't want HPV to do its thing, right? So you could have HPV your whole damn life. Don't nobody care. Don't nobody care. Don't nobody care. But if HPV starts to make that pap smear abnormal, HPV starts to give you growth in the throat, HPV start to do stuff in that booty, and we'll talk about what all that means, then we're concerned about HPV. But HPV in and of itself, it's viral. It's not a whole lot we can do about it other than get the vaccine. So please get it for you and your kids. And if y'all want to talk about that, we can talk about that too. Your sons and your daughters, please get it. Please. Okay. But HPV is one of those things. Okay, if you got it, you got it. Don't be spazzed out about it as if you got like chlamydia that won't go away. No, if you got it, you got it. But what we're concerned about is the activity of it. And it's like, well, how do you control the activity? Okay, you're not concerned that I got it, but how do you control the activity? You control the activity like you would with any other virus by strengthening your immune system. Now, again, please get the vaccine. The vaccine is for ages 9 through 45. I say 9 through 45, okay? And so at the end of the day, that's why they call it Gardasil 9. It stops 9 major types that we know are associated with certain cancers. It's not going to stop you from getting any other type. It's not going to take away the types you already have, but it'll prevent you from getting any types that you don't have out of those 9, because it's like 300 types. but we know 9 of them are about that life. So whatever out of the 9 you don't have, it will prevent you from getting. And then whatever type out of the 9 you do have, it'll kind of keep it controlled a little bit. Now the other 300, you can get any of them, child, but again, it'll keep it controlled, and those are not as associated with cancers as the others. Does that make sense? And when we talk about cancer, we're not just talking about cervical cancer, we're talking about anal cancer. So, for my mommies who are out there, doing the anal sex thing, which, hey, listen, do your thing, sis. No judgment over here. But for me, I tell my patients, please tell me, because I'm going to pap your booty. Yep, I'm going to pap your booty. And if you have if you come back HPV positive in the anal region, then I'm going to send you to one of my colleagues who does colorectal. And she got some stuff going on. I think she created a procedure. I don't know what she did, but she's super smart, right? And then I let her deal with the HPV of the booty and surveilling that and what we got to do. And for everybody who decide that they want to be freak-a-leaks, all of y'all, and it's, hey, listen, we're grown. You have sex how you have sex. But for all of those who, oral sex, males and females, and the swallowing and all the foolishness, yeah, you get HPV lesions in your throat. Ask an anesthesiologist when they putting somebody under what they see, because it's out there. So yeah, HPV is one of those things we really just have to watch its activity. We can't get like obsessed with having it. Okay, we got it, it's there. Okay, I'm human. Let's say you had sex with 20 people. You always use a condom, but the condom broke this one time. Okay, now you got HPV 16, 18, and 45, bunch of the scary ones. It don't make you a hoe. You didn't do anything bad. Okay, we're going to keep an eye on it, and we're going to make sure it doesn't progress toward the thing that we're trying to prevent, which is a cancer. Because people be like, well, I ain't trying to get pregnant. I ain't trying to get no diseases. I ain't trying to get HIV. And I'll be like, are you trying to get cancer? They be like, what? Yes, that's a risk. That's a risk factor. That's a risk factor for having unprotected cysts. Having unprotected cysts. Yes, yes, yes. A sleep aid for insomnia. I'm gonna tell you one thing you'll learn about me is I'm smartly holistic. What does that mean? Because don't be walking around here with no high blood pressure talking about something. I'm gonna take some red yeast rice and I'm gonna be all right. You not. But I don't believe there's a supplement. I don't believe that you should take stuff for everything. For people who, now people generally have some insomnia issues. A lot of times that's going to deal with anxiety. And I'll talk about sleep hygiene as well. And then another thing that it's not like I didn't know this, but it really kind of just got brought back to the forefront. A lot of times people have restless leg syndrome and don't know. They feel fatigue in their legs. They're shaking their legs. They feel like stuff is crawling in their legs. Did y'all know that's what we call venous insufficiency? Yes, venous insufficiency. And if you're one of my patients and you're watching, give the office a call. Excuse me, let me know if that's something that you're suffering with, and we'll send you to the vein specialist. And yeah, they'll do like a little vein scan. Excuse me, child, that Topo Chico done got me. They'll do like a little vein scan, and they'll see whether there's insufficiency or not. And there's procedures that they do, no downtime. They do it the same day you walk out. So a lot of y'all's insomnia may have to do with that. You got to turn your brain off. What do I say? And I recommend this for my patients when it comes to for sleep hygiene. Don't get up a million times at night to pee. So cut off a couple of hours before you go to sleep when you're drinking water, whatever. Cut that off. Make sure your bedroom is nice and cool. Don't have a, terribly hot, warm bedroom. Turn off your TV. Your body or your brain does not go into what we call REM sleep or deep sleep if the TV's going. So like your eyes are closed. I'm in Atlanta, my dear. Your eyes are closed, but your brain is processing what is happening on TV. It's watching that infomercial all night. It's watching that movie all night. Even when it comes to social media, please put your phone down about an hour or two before you go to bed. Put it on do not disturb, except, you need to hear from your kids. You need to hear from your parents in case something goes down. But otherwise, put that phone on do not disturb. Make sure that room is cool. Make sure it is dark. Honey, I have blackout curtains. I play not with it. And then make sure that the TV is off. and your social media is off, and allow your body to come down and relax some. And I think those are good ways. Read, journal, like allow your brain and your body to just settle and make sure it's nothing physical as well. But I'm not one for people like, oh, try melatonin, try Benadryl, try this. To me, it's like, what are we really doing? Like, what are you treating? Like, what's happening here? And I don't want you guys to get in a space of, I don't want you guys to get in a space of, what am I trying to say? That everything natural is good, or that every supplement, oh, it's a supplement, so it's good. That's ridiculous. One of my rules in my practice is this: if you can tell me why you're taking something, then you can take it. If you can't tell me why you're taking it, don't take it. Like people are like, oh, I take B complex. I'm like, why? And then they start searching. My metabolism. Who told you that? Who said that? What? First of all, most of the B's deal with your nerves. Your nerves. That's what it deals with. You got B6, and your vegans are going to be low on B6. Okay. And then you have B12, and people always want to give you B12 like it helps your metabolism. It doesn't. It doesn't. That's not what it's for. I'm gonna get a B12 shot. It's gonna help me lose weight. Who said that? And actually, it can cause a lot of problems if you're getting B12 shots and you don't need them. Most of the people who are going to be deficient at B12 are going to be people who had gastric bypass surgery. And the reason for that is because the part of the small intestine that makes the B12, we bypassed it in order to help you lose weight. Um, and that is why those people are deficient. But don't just randomly take stuff because it sounds like a good idea, or you read somewhere that it might help you. Now I'm looking at the comments because I'm trying to look and catch everything, and I'm looking at the comments to ask about. Not somebody said I'm scared of the dark. Child, if you don't go to sleep somewhere, put you a little night light somewhere. But I'm scared of the dark too. But when it's time to go to sleep. But somebody asked about hysterectomy. They said that since they had their hysterectomy, they've been unable to sleep. Somebody said they wake up to go to the bathroom, or the night sweats wake them up and they're unable to sleep. Again, that is a part of menopausal syndrome. So you're somebody who certainly, I would say, maybe, try and come and have a consult about bioidentical hormone replacement, and go from there. So, as far as gastric sleeve is concerned, no, they didn't touch your small intestines when you had gastric sleeve. They just made your stomach smaller. And so, the B12 is doing what the B12 does. You need a vitamin. Make sure you're taking vitamins. Make sure you're all taking vitamins. And y'all know I'm the vitamin D lady. I'm obsessive. Like, seriously, I need to get like a tattoo that says vitamin D because I don't play about it. So, y'all need to get on your vitamin D. Okay. So, I'm serious about that. Anything anything that we have not touched? Can we talk about an African wash scrub? Because I know you hate a loofah. Baby, I hate a good loofah. Now I'm gonna tell you, we just did a whole, I don't know, man, we just did a whole half an hour, maybe 35, 40 minutes on hormone replacement. So you're gonna have to go back and redo the video. But anyway, yes, I'm glad you had your PCP prescribed, your vitamin D, girl. But yeah, so when it comes to vitamins, a couple things. So first of all, once you get to a certain age, and even in general, and please give your kids vitamins too. And I'm not a fan of any gummy vitamin. I know some people can't take pills. If you, as far as your kids are concerned, no, give them the regular old Flintstone vitamins, the gummies. I feel like they have too much sugar. Or a regular vitamin. They have this vitamin called polyvisol. It's good with iron. It's good for vitamin. It's a liquid. You can put it in their juice in the morning when you give them whatever. They won't know. As an adult, a Centrum one a day silver if you're over 50 or 40 or 50. That's perfectly fine. And they also have a vitamin. They sell it on Amazon. It's supposed to be really, really good. It's called Mary Ruth. And it's a liquid. They have different flavors. You can put it in your juice if you can't swallow pills. But please, you should be getting vitamin supplements. And 85% of African Americans are deficient at vitamin D. I give my patients vitamin D all year round. I got one patient. I'm looking for her. We done called you. I don't know what the heck she out here doing. She out here doubling up, tripling up pills, taking D and 3. Baby, so the recommended dose the recommended range of vitamin D is from 30 to 100, and it doesn't actually start fighting disease in your body until it's around 70. So I like to keep my people between 70 and 80, or 70 and 90, or something like that, right? This lady out here at 135. If you don't stop taking them vitamin D for a couple months, I know something. I don't even know how you got up that high and you brown skin. But anyway, so case in point, that is something, that I keep my patients on year round. I check it. It's a big deal. And, they say, oh, black people get this more and black people get that more. That is not true. We don't get anything any more than anybody else, but we are notorious. Yeah, you can take Geritol. It ain't fitting to hurt you, girl. We are notorious for having increased risk of this and increased risk of this and heart attack and stroke and diabetes and cancer and all this. And it's because 82% of us, specifically 82%, are deficient in vitamin D, and it's consistent. So I am big on that, and I believe that it will certainly cause a change or a stir or a turnaround in your health. If your doctor doesn't want to prescribe it, that sucks, because why not? And then when they say, oh, your vitamin D is 35, you're good, be like, no, I need it to be 70. I need it to be 70. Run me some vitamin D. Okay. If they don't want to do it, then go ahead and take the over the counter. Take 2 or 3 of them if you have to, but just make sure those numbers stay up. Yeah, that is that. Yes, do you think there's enough multivitamins, citrate, huh? Do you think we get enough in a multivitamin? Yes. Now, this damn magnesium, I'm so glad somebody brought it up, because magnesium burns my ass. Okay. I get mad. And again, when I hear somebody say, oh, I'm on magnesium, the reality of the situation is, again, is something that was heard on TikTok. And I'm not picking on TikTok. I like TikTok, right? Well, hold on. It got too much going on. It got stuff going up the sides, the words going up here, music is playing, somebody talking. It bothers my anxiety. I don't know. Must have to be, 45 and under. I don't know. I don't mess with it though. It's too much. It's too much. Okay. I don't need that kind of negativity in my life. It's too much. But let's talk about magnesium, okay? Because magnesium is a big one that people tend to very much take for granted, and they play with. And you keep playing with it and see what happens. Now, there are some things that are in your body that you're not supposed to have a lot of, right? And magnesium is one. It is a trace element. And let me just break down the purpose, or what magnesium does, right? For all intents and purposes, that would be important to you guys. It does a lot of stuff, but this is what's important to you guys. So when you have a muscle, calcium makes your muscle contract, but magnesium makes the muscle relax, right? So this is why people say, oh, I feel relaxed at night when I take it. Oh, it kills the cramping in my legs because it combats calcium, right? And so a lot of times when I see it, I'm like, are you hydrating? Are you dehydrated? Why are you having muscle spasms? What is actually happening? Now, when we talk about muscles, right? There are muscles everywhere. You have respiratory muscles. It's called your diaphragm. You actually even have muscles in your blood vessels. Okay. So the thing is that y'all got people scooping stuff into this sleepy time tea or this mocktail or whatever it is y'all are doing. And some girl, I watched it one day. Somebody sent me a video, and it was like, well, I just put it into the spirit move me. And I said to myself, she keep on scooping that damn magnesium, she gonna meet the spirit in person tonight. Okay. And the thing is that, think about this. If it fights with calcium, right? Then that means that using enough of it, and you would have to use enough of it, but it builds up. It builds up in your system. It can fight your respiratory muscles. And now we're not breathing the way we need to be breathing. It could decrease your blood pressure. And some of us can't handle that. So at the end of the day, magnesium is not one you want to play with. If you're having muscle spasms, I say the first thing you need to do is hydrate. If you're having, it makes your legs feel better, and then you're able, that may mean you have some venous insufficiency. You want to get that looked at. But magnesium is not one that I like to play around with, and I don't encourage other people to play around with it. But do you, boo? We don't judge over here. We listen. We don't judge. We listen. We educate, and we do not judge. Just not my thing. Who has enlarged from too many stents? Huh? Okay, so first and foremost, now I can answer medical questions, right? But when you guys give me specific questions about your specific health issues, I can't really go in on that because I don't have enough information to intelligently answer. So don't think that I am ignoring you, because I'm not. But the reason that I can't, I'm not going to ever give you information that does not make sense or is not fully accurate. So there are some things I just have to leave alone, and go from there. So somebody said, I suffer from dehydration a lot, constantly drinking water. Well, there are a couple of things. When you feel like you're constantly dehydrated, you may be. Is it a particular medication that you're taking that is causing this? Or do you have a very high salt diet? If you're like, no, I don't have that, and and I constantly feel thirsty, that's a sign of diabetes. And so you may want to get checked for diabetes. But also, check your diet, if you're eat with balance. So if you're taking in a lot of salt, yes, your body's going to feel like, I need water, I need water, I need water. Somebody asked about eating ice chips. It's called pika or pika. It's called pika, one of them, pika, pika, whatever, but it's PICA. And a lot of times it'll come with if people have anemias, but it can also come if you have a zinc deficiency. People don't be knowing that. So y'all be like, oh, I like ice, I'm anemic. Who told? That has come down through the generations, but it is true though. So if you are anemic, you will have pika or pica. Some people eat cornstarch. Some people eat toilet paper. Some people eat sheetrock out the wall. Don't judge these folks. Some people, eat the ice, but that crushed ice from the racetrack, that is busting though. That is busting. I don't have anemia, but if I gets me a chance, and it's a safe area, I'm gonna stop and get me some of that racetrack ice. That thing is busting. But nevertheless, let's get back to it. It can either be from an anemia or it can be from a zinc deficiency. Okay, so don't ever discount that as well, especially just if you have these things and it seems like I've tried this and I've done this and I'm still. That's when this is what the purpose of this stuff is for, to be able to go to your doctors and be like, yeah, can you test me for this, because I understand that this is a symptom of this okay, so that could be a thing. Trying to make sure, can you please speak on adenomyosis, girl? Ooh, child, I hope you don't have that. If you do, Lord have mercy. Adeno is rough. So adenomyosis. I think that's one of the things that people throw around, and can coconut water hydrate you? Yes, coconut water is amazing, but not that sweetened stuff, just the regular old, the nasty one, because it's nasty. If you like it, more power to you, but it's nasty. I put coconut water in smoothies. If I make a smoothie, I do put coconut water in it, versus regular water. But either way, and guys, if you're drinking water, please, 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 drink alkaline water. Okay. Alkaline water, because no disease, not even cancer, can live in an alkaline environment. So your goal is to get your body as alkaline as possible, because no disease can live in an alkaline environment. Not nothing. Okay. So look up alkaline vegetables and make sure you're eating them. Drink as much alkaline water as you possibly can. Just do all the things that you possibly can to get you as alkaline as you possibly can. As sharing my jewelry. Okay. My jewelry. Let me tell y'all something. Let's talk about stuff like that in general. I'm a fashion girl at heart. I'm a fashion girl. I'm a jewelry girl. I'm a clothes and shoes girl. I'm a bag girl. I'm not superficial. meaning, honey, I can wear a pair of sweatpants from Target. Well, before Target got banned, because we ain't doing Target. But I can wear a pair of sweatpants from Target, Abercrombie, anywhere, a t-shirt. But the girl gonna have her a good shoe and a good bag. I just do. I'm saving the live, my love. I just do. And so let's talk about it. This is Van Cleef. This was a birthday gift. It's a Michelle W. watch. Interesting. I don't know where this came from, but I think she cost a penny. And this, I think, is like Amazon or something. I ain't scared to wear Amazon either, too. This is like an Amazon ring. These earrings are Schiaparelli. These are scaps, not to be played with, honey. Woo, child. This ear cuff is from some like local jewelry company. I don't know. I was on the internet in the middle of the night and it looked cute. And I'll tell y'all why I wear so many ear cuffs. And this one is Hermes. This one is another local jewelry company. No, this one is another local jewelry company. This one and this one came in pairs. And then this one, I think, is the Zon. Now, because people are like, oh, the ear cuffs, like if they're a new thing, baby. The girl been on the ear cuffs, been on them, got the been on them. What's one of my favorite pieces? Do I say? Because I be dropping my stuff on my dining room table. Like when I come home, I comes out of everything. I don't know why, but my hole split. I had it repaired. It cost $2,500 to have it repaired. Had it repaired. It split again. Now, me and the surgeon are cool enough, but his associate had done it. And I ain't like his attitude. And now the associate is gone. But I feel like when I went back, like, it split again. I don't know. It's not like, I feel like he should have gave me a discount. Like, maybe I'm being petty. I don't go to anybody's business. Like, give me a discount because we both doctors. I don't do that because we got bills to pay. Like, we got bills just like everybody else. So I don't do that. But I paid you $2,500 and it wasn't even a year. And she got split again. So I'm like, at least you could have been like, girl, let me fix it for, even if you ain't charged me the 25, you wanted to charge me 18 or 19. You could have had some kind of professional courtesy better than, yeah, we can get it done. Go ahead downstairs and schedule. Wait, what? So I have on this ear, I have two separations. So for one, I use these little fabulous little tape things and it helps my earrings stay in. And then the other, I just cover up with my ear cuff. I'm not willing to pay them people another 2020. I'm not willing to pay. I'm sorry, y'all. I'm not willing to pay them people another 2,000, to fix this ear right now. I don't wanna. And then it's cute without getting it fixed. So there's that. But yes, I'm gonna wear a good piece of jewelry. So I wasn't ignoring you. I missed it, my love. The silver stuff from the other day. Oh, okay. So I had this big choker on that came across here. Do y'all know I got that from the Amazon? But then I had like a double up type of situation, and I got that from Dylan Lex. And Dylan Lex is spelled DYLANEX, and it is a Black owned jewelry company. The stuff ain't cheap, but it's bussin' and it is eye catching, and I love it. Like I said, I mix highs, lows. So I'm gonna have a Dylan Lex on with an Amazon. I'm gonna have an Hermes with an Amazon. I'm gonna have, so I do highs and lows. I like what I like. I'm not a label whore. I like what I like. And there's that. Okay. So y'all were talking about somebody asked, okay, so adenomyosis is one I said I was going to talk about. And then y'all keep asking me about these injectables, the GLP-1, the semaglutides and the tirzepatides. And I did a whole thing on that, but we're going to talk about that, honey. Can we talk about women in menopause and in and out of pH control, what to do? Yes, we can. And I don't believe that there's a strong association with menopause. When we talk about BV, guys, and I don't know if you've seen my BV videos, I don't know, whatever, but we can go over it again, honey. But BV is a consequence of poor treatment for BV and lifestyle things that you're doing that you don't realize are causing BV. So you keep doing them. And then you think the medicine is failing, which it is most of the time. And then it's just a big, giant plethora of failed medications, poor lifestyle, failed medications, poor lifestyle. And then you're like, I keep getting it. Or is it this that it didn't go away? So we will get into the BV talk momentarily. Let me just quickly touch on adenomyosis because somebody talked about it. And adenomyosis is a very blah place to be. So the uterus has 3 layers, and I think we did talk about this before. The uterus has 3 layers, and if you can stop and think about this, like think about that ice cream, that the vanilla chocolate and strawberry ice cream, right? That Neapolitan, whatever, the vanilla chocolate strawberry ice cream, right? Think about that. The uterus has 3 layers like that, right? And think about the inside layer and the middle layer. So your inside layer is what you bleed off every month when you have a period. The inside of the uterus, you bleed it off every month. That's what it is when you have a period, right? Um, and the middle layer is the muscle layer. That's the muscle. That's the thing that hold that thing together. That's the muscle, right? The outside layer, I call it like the saran, right? Right. But the inside layer is the part that you bleed from, and the middle layer is the middle layer. Well, when you have adenomyosis, that inside layer digs into that middle layer. It digs in. So, and then it kind of just like it gets its clutches in there. So the periods are more painful. The periods are longer. The periods are heavier. And up until now, the only treatment for adenomyosis, not up until now, but up until about maybe 10 years ago, the only treatment for adenomyosis, all right, we're gonna get to the eyeglasses too, Miss Becky. The only treatment for the adenomyosis was hysterectomy, but now we have a treatment called a UAE, or uterine artery embolization, and we go in and basically block off like 80% of the blood supply to the uterus. No, it doesn't die because it has blood supplies coming from small other blood supplies coming from other places. But with the uterine artery embolization, it makes the pain, the discomfort, the periods, the bleeding, and all the things associated with adenomyosis, it makes it that much better. And worst case scenario, if you get a uterine artery embolization and it's still I'm just uncomfortable, I can't take the pain, well then you can always have a hysterectomy, okay? But that's adenomyosis, that's what it means. And unfortunately, it's not a whole lot that can be done about it other than a uterine artery embolization or hysterectomy. Okay. Now, GLP ones. I'm a crush a lot of people. I'm a crush a lot of people. Okay. I don't know whether y'all know it or not. How do I control my acid reflux? Girl, get you some Nexium. Stop eating such big meals and sit up for 2 hours after you eat. Boom, there you go. Now, the GLP ones, y'all know I don't even call it weight management at my practice. I call it metabolism management, because that is how you lose weight, when you understand. And again, I had to do a little training for this, do a little obesity medicine training for this to understand it. But when you are losing weight or attempting to lose weight, your reason for being overweight has to be understood. You're going to lose weight. Girlfriend A is going to lose weight in a different way than girlfriend B, depending on why y'all are overweight. And this is why a lot of times trainers have such poor luck, and no disrespect, but they get on my damn nerves. But anyway, and I'll tell you why as we should have a conversation. So when it comes to GLP-1s, first and foremost, you have the real, you have the fake, or AKA you have the real, you have the compounded. You don't know what the people. So you got all these weight loss clinics, you got all these people jumping up. Oh, we got a GL, we got semaglutide, we got tirzepatide. Unless it comes from the company, unless it comes from the pharmacy, that is 9 times out of 10 compounded. When you get them big needles that you got to stick yourself, the regular stuff that comes from the company is in the pen, and you click the pen. Babe, when they giving you them big needles, girl, that is compounded. And what does that actually mean? It means it's probably like 2 or 3 drops of medication. And the rest of the stuff, we don't know what's in it. I don't know, whatever the compounded pharmacy put in there, you don't know what's in it. And it's like, people were so scared to take damn vaccinations, but y'all quick to jump up on the fake shot. And I don't like it. That's the first and foremost. As far as GLP-1s, let me explain what they actually do. A GLP-1, and don't think people like, oh, she just don't like them. No, in my metabolism management, I have patients who are on them. I pick which ones I want the patient to be on. If your insurance company does not cover it, we go directly to Lilly Direct or whatever other company, Wegovy Direct, whatever, because the company itself will actually be cheaper than some of these compounding pharmacies that are giving you the not real drug. You can actually go directly, if your insurance company don't cover it, you can actually go directly to the company, have your prescriber prescribe it through the company, and then they will send it to you for a cheaper amount than these weight loss clinics are charging you. And that was their purpose, to say we don't want our name put on fake medicine, and then you have these side effects that we don't know nothing about, and then you blaming our medicine and giving us a bad name. So we rather you get it from us for a discount than be going to get it from Jim Bobbity Snippety from wherever, and it's problematic. So there's that as far as that. Next, and most importantly, girl, is here's what GLP-1s do. I think some of y'all think that GLP-1s burn fat or so. It doesn't. GLP-1 has two jobs. It has two. It decreases how much you eat, and it makes you full longer. That's all it does. That's it. That's all it does. Now, can I drop a bomb on you? Y'all ready? Because this is real game I'm giving you. If you are insulin resistant, like most African Americans are who are overweight, if you are insulin resistant, a GLP-1 is not going to help you that much. Maybe a pound or two a month, but not really. Why? Because if you're insulin resistant, you hear me? If you are insulin resistant, how much you eat is not important. What you eat is important. So if you're insulin resistant, you're somebody who should not be eating a lot of carbs at all. My patients know no sugar, no rice, no bread, no pasta, no potatoes, no oatmeal, no yogurt, no quinoa, none of all of that. None of it. None of it. Okay. You get a few net carbs a day. That's what you get. But that's how you're going to lose weight if you're insulin resistant, right? So I don't care how much salmon you eat. I don't care how much broccoli you eat. I don't care how much kale you eat. I don't care how much you eat. But you eat 2 donuts, you're going to gain weight. So you see how your GLP-1 is not really going to help you, because it's going to allow you to eat those 2 donuts, which means you're going to keep gaining weight. So for my patients who are insulin resistant, we do a little something else. Now, if your insurance company covers it, hey, they cover it. I will add on the GLP-1. I manage it. I follow you. I follow you with, every 5 weeks in my metabolism. We change up medications. We do this, that, and the third. You have a prescription plan for your exercise, because guess what? Not everybody can lift weights. I just wanted to tell you that, because if you insulin resistant and you out here lifting weights, you gaining weight, sis. I don't want to squabble about it. And a lot of times, this is why I say I don't like trainers. And it's not that I don't like you personally, because I don't know you. But a lot of times, in order for somebody to lose weight, you're not training their body. You should be training their metabolism. You should be training. You have to understand their anatomy and physiology. You can't have a group training class, because everybody is overweight for different reasons. So this exercise is going to work great for her. But if she's over here lifting 25 pounds, she's gaining weight, and you don't get that. So what you do is you might lose 5 or 7 pounds, something like that. What's the question? I missed it. Hold on, y'all. Nicole said, what now? Because I missed Nicole's question. I'm not trying to be disrespectful, but Nicole, you might have to throw that question back up there, because I missed it. Okay, somebody said, good question. I was thinking the same thing. So go ahead on and throw the question back up there, Nicole. How do you determine whether you're resistant or not? Honey, you're going to have to come to Dr. Rogers' program, because what I'm not fitting to do is give up all the tea on the live, okay? Because everybody didn't come in peace. And I don't need nobody out there trying to jack y'all up, okay? So come on in. I'll let you know. Give you a whole plan, give you an exercise prescription, a meal plan, the whole 9 yards. We put you on meds, and every 5 to 6 weeks we follow up. And trust me, it ain't going to be what you pay these other people. But at the end of the day, it is about getting healthy, losing weight and getting healthy. And my people don't have that sunk in face or all the wrinkles and looking old. No, they look healthy, and they're smaller. Way smaller. So we're averaging probably about 9 to 11 pounds a month. So I think most of the people who are on my program, by the time they reach a year, if they need to be on the program, that child don't log off if you said phentamine. Those people who are on the program for a year or so probably are around 100 pounds at a year. And then once we kind of get you to where No, ma'am. Medicare, no, we don't accept Medicare or Medicaid. But we don't accept insurance for weight management, period. But anyways, but if you what was I saying? Damn, I lost my train of thought. I don't know what I was talking about. What was that? See? But anyway, so yeah, there's that. That's the whole GLP-1 thing. But yes, I manage it. Yes, I like them. There's a place and time for them. There's a way you manage them. You can't just give somebody the shot. No, you have to change their metabolism. You have to feed them a certain way. You have to train their body a certain way. And there's a bunch of different stuff you need to do. So somebody's like, I'm on a shot. I just look at you like you're crazy because that doesn't mean anything to me, and it really doesn't mean anything to you. So don't waste your money. Get with somebody who is going to help you get healthy. And when you're done the shot and when you go into the maintenance aspect of whatever program you're on, you'll look great and you'll feel great. Okay. So there's a thing. Got it? Okay. Now, 1 cup of a fruit in a window of 6 to 8 hours. Yeah, Miss Chosen Girl, that's not such a thing. And we don't eat all fruit. We cannot. Bam. So, all right, let me get on to BV because I know y'all loves a good BV, honey. Y'all will tear this BV to pieces. All right, so, but I be serious about it. And I do multiple videos about it. I got to look back and make sure I did do multiple videos, but I know I've done at least one video about BV. And if we still have time after that, because I goes in on BV, somebody keeps asking about a Bartholin's cyst, and we could talk about that as well. Now, when it comes to BV, I have a cleaning cute bar. I'm loving it so far. Hey girl, hey, thank you. If your cycles are getting closer together, is that a sign of perimenopause? Not necessarily. It could be a bunch of different things that's happening. So not necessarily, my dear. Okay, so BV. Bacteria, vaginosis, vaginitis, it's all the same. All right, it's just different words for all the same. Now, I'm gonna tell y'all what, and I think it's cute. Y'all done pulled us into let's say, but first visit must be in person. Yes, that must be one of my patients. Hey, lovey. So couple of things. Now, when it comes to BV vaginitis, y'all done pulled us into this pH balance foolishness. And it's not foolishness. It's one, like I said, people will jump on all types of bandwagons. And what they try and do is they read a couple lines of a medical article. Sometimes that's all they can understand, right? So they read a couple of lines of that, and then they try to incorporate common sense. And then they come out with this whole little thing. And then y'all like, oh yeah, that do make sense. And it'd be a bunch of bull stuff. Okay. So we can call it pH balance. We can call it whatever you want to call it. It is what it is. Okay, fine. Yes, we have the vagina, or the secretions in the vagina are more acidic. The secretions in the semen are more basic. And with 7 is in between, so when you're dealing with acid bases in school, blah, blah, blah. Okay, fine. Doesn't really mean a whole lot, but okay, fine. People want to attach a name to something cool. Now, when we have BV vaginitis, let's talk about it. All right. And I'm going to give you guys the talk. Since y'all joined me this Friday evening, I'm y'all first date of the evening. I ain't going to keep y'all too long because I know some of y'all got to tie your hair down and get ready for the club. Okay. Now, when you have BV, a couple of things. There are 7 different types of vaginitis. Okay. 7 different types. And one type specifically it can be caused by oral sex. So yeah, make sure they teeth are right. Okay. If he got stinking breath, then don't let him do that to you, because have him go to the dentist. Anyways, lest we digress. So there's 7 types of vaginitis. Okay. Unfortunately, most doctors' offices only check for 2 or 3. And that good old metronidazole, that good old metro gel, that good old has a very high failure rate. It only treats 4 of the 7 types. So if you're only tested for 3 type, you're only treating 4 type, but there are actually 7 types. Can you kind of see where the problem will come in? Can you kind of see where it's like, are you, yes, girl, literally, are you being reinfected, or were you never treated the first time? I don't know. But In my practice, we don't use that medication for any good reason. Unless, if you have trichomonas, then you got to use it. But if you have just regular old vaginitis, I don't use that. Why would I use something that has a failure rate? Why would I give it to you? It's miserable. It tastes nasty, right? And then y'all come back and be like, oh, I got to give you another medication because the medication I gave you didn't treat everything. So I just don't use metronidazole or Metrogel. Okay. That's me. Now, so medication failure is a big part of BV. Okay. Now, the next thing when it comes to BV is actually lifestyle. Lifestyle. So even if you get treated, and let's say you got one of the types, that Metrogel or metronidazole treats, right? Let's say you got one of those types. So you treated it, but your lifestyle is creating an environment where you keep getting it. Okay, so let me explain to you guys the rules. And not that I know of, but in my practice, there is nobody who has recurrent BV. Now, that's not to say that there's nobody who doesn't get BV again. That ain't what I said. Because my patients will call and be like, Doc, I went here, I did this, um, and I got BV again. But they know why. They know what they did. I ain't mad at that. We're going to treat that and we're going to move on. But there's nobody who be like, nope, the treatment you gave me, it didn't work. Nope, I still got symptoms. Nope, I still got nobody. Nobody. And so y'all ready? Y'all ready? And I don't want to argue about this. I don't want to squabble about this. Sis, you ain't got to do nothing you don't want to do. You don't got to let go of no product you don't want to let go of. You ain't got to do nothing I'm telling you to do. I'm talking about me and mine over at Atlanta Premier. That's what I'm talking about. You ain't got to do nothing. I'm just trying to help you. That's it. Okay? So let's talk about it. First and foremost, never shampoo your hair in the shower. You heard me? Okay, I just want to make sure you heard me, sis, because the way you took a deep breath, I just want to make sure you are right. Okay? Never, ever shampoo your hair in the shower. Okay? Never use liquid soap of any kind. I said it. I don't care how natural it is. I don't care what it's made with. I don't care if it's made with the tears of sweet baby Jesus. Baby, if it's a liquid soap, you got vaginitis. You're going to get vaginitis. You're going to keep getting vaginitis. I don't care what the situation is. You heard me? Okay. And we're going to call it like it is because this is my YouTube. No antibacterial. So y'all be like, I use this. It's antibacterial. Antibacterial for your hands, sis, not for your coochie. Okay. So no antibacterial soap, no perfume soap, no deodorant soap, no Summer's Eve, no Vagisil, no baby wipes, no Refresh, none of it, none of it, none of it. And yes, I did say no baby wipes, and I'll give you a remedy for that. Okay. None of it. If you use it, you got the ooey. People are like, well, I smell like fish if I don't use it. No, you feel like fish because of it. It just keeps perfuming it away for 24 hours. So that gives you a little reprieve. But no, ma'am, it is these things that is, yes. Now, when I said no baby wipes, you ain't a baby. Stop that. You can do things to non-estrogenized skin that you can't, like little girls can do bubble bath. You can't get your big grown behind in no bubble bath, no bath bomb or nothing else. Cause no, ma'am. And I don't care. Didn't I just say, I don't care who make it. I don't care how natural you think it is. If it's a liquid soap, hey, listen, I love Dr. Bronner's too. It is absolutely amazing. I take it to the nail shop so they can put it in my water and for my feet. But that ain't for your coochie. Just saying. Now, what you can use. Now, again, I'm just telling you what I tell my patients. I'm telling you what I do. I'm telling you all of it. Okay. When it comes to what you are going to use, because what you're going to stay away from is stop soaking your behind in Epsom salt. Oh, my vagina itching. Oh, this going on. Oh, I'm so irritated. Oh, but you're soaking in Epsom salt every day. It is salt. These people ain't lie when they put it on the package. It's salt. Okay. You are pickling that coochie. It's a Slim Jim. That's what you make. That's what you making it. You making it a Slim Jim? What you doing, sis? I'm just asking. So you're going to use, there are two soaps that I co-sign. I only co-sign two soaps. I have no shame. And what you're going to do is you're going to get online and you're going to find something called water wipes. Okay. It is 99% water, 1% aloe. Water wipes will be fine for your cooch parts. Okay. Just saying. Now, when it comes to soap, there are only two soaps I co-sign. Now, my soap that I created, the Clean and Cute body wash bar, she's that girl. Now, I created her about 4 years, 3 years, I don't know, 2, 3 years ago, something. I don't even think it's been 3 years. I think it's been about 2 years that I created her. Not only does she smell magnificent, like a shower in Bali. For all of you who don't know, my background or my undergrad degree is in chemistry. So a lot of the products, all the products that I made, it comes for a purpose, right? And so I created a preservative that's going to kill MRSA on your skin, staph and strep, any type of fungal infections on your skin. It helps with hyperpigmentation. It helps with dry skin. It helps with stretch marks. It helps with all the things, itchy skin. It's amazing. Some people even say it has decreased their discharge. I don't know. I ain't fitting to put that on the commercial. I don't know. But at the end of the day, it's that girl. If it is something, and I'm not a self-serving doctor, this is not about buying my product, it's about the truth. But at the end of the day, if that's something you cannot do, that's perfectly fine. For 20 years before I created Clean and Cute Body Wash Bar, I would tell my patients Dove Original. Dove Original, Dove, 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 Dove Original, Dove. If Dove, you can hear this, y'all need to be calling me because I know y'all sales is through the roof. Yes, they have it at Costco. It's on sale at Costco too right about now, but Dove Original. Okay, so if you can't get my soap, which when you get it, you're going to be addicted. I'm letting you know now. Check the comments. But if that's something you can't do, that's perfectly fine. It is what it is. Okay, it's not that you can't get fixed if you don't use my stuff. I'm not saying that. Okay, but it is the Clean and Cute body wash bar. It's that girl. She's a moment. I actually just created an eczema bar too. And people always go for this oatmeal stuff when it comes to eczema. No, this has about 6 or 7 different oils in it. The oils are antibiotic oils. They're essential oils. They actually help kill the infection that comes and helps with. It's that girl. So we have the hidradenitis soap for people with hidradenitis, and that's a skin condition. And then we have the eczema bar soap, but for everyday use, even on your cooch parts, is the Clean and Cute body wash bar. And no, ma'am, no dye, no whatever you have said, antibacterial soap. We ain't using that. Now, as far as the Clean and Cute body wash bar, I don't know how to pin all this stuff. I don't do that, and my team is not here. Please just run over to Clean and Cute Wash over on Instagram, Clean and Cute Wash or Clean and Cute dot. It was a Clean and Cute dot shop. Okay. And everything is there. So somebody will pin that for me, Clean and Cute dot shop or Clean and Cute Wash on Instagram, and the link is in the bio and all the stuff. Oh, I gotta tell you about new product too, but we gotta finish with this vaginitis thing. Okay. So I told you what you can use. I told you what you can't use. It is what it is. You hear me, you hear me, you don't, you don't. Now let's talk about sex and BV. Child, let me sip on this first. Now, I don't care what people try to say, right? BV is not sexually transmitted, but it is sexually associated. You say, well, what does that mean? Okay, let me break it down for you. So people think that semen is just sperm, right? Nah, it's sperm, it's urine, it's blood, and it's pus. All the things. Okay. So at the end of the day, everything that a man does, his diet, what he eats, if he does not drink water, popping perks, sipping lean, the hookah, all that is encompassed in his semen, right? And so when you have unprotected sex with that person, it's supposed to be, here's where the pH stuff comes into. So it's supposed to be like, we have a lower pH, they have a higher pH, we're supposed to neutralize. It comes in the middle at 7, which is water. And then it just kind of like, it's supposed to flow out of the vagina and we're supposed to be fine. Well, that's probably how it was in the Garden of Eden, child. And that's probably how it is in the jungles of Ecuador, child. But here in the city of Atlanta, no. So when they're off, they obviously set you off. But it's not about another woman. 9 times out of 10, it is their lifestyle. They eating a bunch of Takis, they eating a bunch of Chick-fil-A and fast food and not drinking water and not having vitamins, or they got medical problems that are not treated. Sometimes I even see it in the ultra healthy. And why is that? Because they at the gym, they taking all these supplements. They don't know what is in them damn supplement packs at the vitamin store. They just grabbing and just throwing 10 or 12 of them back at one time. Okay. So yeah. Yeah. And if it's a problem, then my attitude is, if you find that every time I be fine, and every time I have sex with him, I have BV, I get BV. Okay, well, then it's time to have a conversation. Have you seen a doctor? Have you seen a urologist? When's the last time your epididymis was checked? When's the last time your testicles were checked? Do you have an infection up in there that might be urinary or something other than an STD that is then setting me off? Did you know that if your partner, if his sugar content in his semen, like if he has diabetes or eating a bunch of candy all the time, if his sugar content is super high, in his semen, it can cause your vagina will respond with a yeast infection. Boom. Yes. All the things. So his health is your health. So y'all better start asking some questions. Okay. Y'all better start asking some questions, point blank, period. Okay. Y'all be so scared. Like, don't be out there acting like pick me's, but then you want to come in like, I can't get rid of this. Well, okay. Well, hold on, sister. So, that is definitely something that, and then people say, well, I use condoms all the time. Yeah, let me tell you about these condoms, girl. So, and again, trust me, this is not a paid advertisement. We don't even really have a good relationship with this company. And when I say we, I mean Atlanta Premier, I mean Clean and Cute, I mean the Dr. Tasha brand. We don't have a good relationship with them, but they have a good product. So I got to bite the bullet and give it to y'all the way it needs to be gave, even though I don't like them. But so the condoms, so okay. People are quick to say, I'm allergic to latex condoms, or condoms irritate me, or condoms bother me, and and they're probably right? But it's because of the lubricant on the condom. So old school is the Noxenol 9, which all the mainstream condom companies tend to use the Noxenol 9. Well, the Noxenol 9 will make your vagina feel nice and swollen. It will make people like, yeah, I beat that thing up. It wasn't you, boo. It wasn't you. It was the lubricant on the condoms. Calm down, settle down. Okay. It'll make the vagina feel swollen and cut up like there's a yeast infection, like it's burning, all the stuff. And actually, if that condom breaks, then anoxinol 9 makes it actually easier for you to contract HIV. Did you know that? Right. So, condom company that I recommend, y'all ready? B, the letter B. B condoms. The box looks like a hologram. B condoms. First of all, it is Black owned, which I love. Okay. They're based here in Atlanta, but it's called B condoms. Go online. You can find them. I don't know where you can find them, but you can find them online somewhere. They got all the different sizes. So, everybody think they wear a Magnum, child, or whatever. So, yes, you can B condoms. That's your girl. So if you're a protected girly, but you just find that, oh, every time I get this and every time there's vaginal, get you some B condoms. Okay. So I done gave it to you for the protected. I done gave it to you for the unprotected. And unfortunately, I'm not going to say what I use to treat. Some of you may know, you put in the comments, that's your business, but I'm not going to say what I use to treat vaginitis because, like I said, y'all know how y'all be. I love my people, but y'all will get 3 lines. Y'all will listen to this and about 5 other videos. Y'all been opened up a damn salon suites, treating all kinds of stuff that y'all ain't supposed to be treating and y'all don't know nothing about. So I cannot, and go from there. Now, and somebody said something about they did this, that, and the third, and they were negative for BV. Again, if you missed what I was saying, let me jump on that. If you missed what I was saying, that how many types of BV are you tested for? Because there are 7 types. So you might be negative for the 3 that your doctor tested you for, but are you negative for all 7? Boom. Just asking. And do you actually have BV or cervical infection? I don't even want to get into all that because that's a whole video in and of itself. So we're not going to do that. As far as clindamycin over metro, but doesn't clindamycin kill good bacteria too? What does that even mean? So it kills the bacteria that it's supposed to kill, but good bacteria, what is that? Are you talking about lactobacillus? Nah, that's not how that works. So no, you actually want the antibiotic that's going to kill the infections that you have versus taking an antibiotic and it's not killing the infections that you actually have. Bam. So all antibiotics have the potential to, I don't know if I'm not sure about the actual question or whatever the case may be. But yeah, so that is that on that. Is there anything else that where did you get this sweatshirt? I got this sweatshirt at Target, y'all. But it was before, it was last year before the boycott. Don't go up in them folks store. Please don't go up in them folks store. We making a point here. But yes, yeah, I told you I will mix high and low in a minute. So yes, she has on a Target sweatshirt with a Van Cleef necklace. I will mix high and low on y'all in a minute. Okay. And then go from there. Yes. Okay. Oh, I want to talk to y'all about a couple of things. So first of all, I don't know. I don't know. I mean, I guess you guys know me. Y'all know my jams. Y'all know what I do. Obviously, you know, clean and cute. As far as Atlanta Premier is concerned, I call myself the holistic gynecologist in the space of I'm going to treat what I need to treat. I'm going to treat what has to be treated, but I'm also going to give you like little, hey, you should be taking what is it? I'm sorry. You should be taking apple cider vinegar capsules, not them damn gummies. The capsules, if you are somebody who tends to struggle with yeast, you have an overgrowth of yeast, you've been ruled out for diabetes, but you tend to struggle with that. I tell people hydrate with alkaline water. Make sure you're watching your carb content. Don't eat a lot of carbs. Careful with the carbs. And then apple cider vinegar capsules that'll eat up any overgrowth of yeast. So like little things like that, I tell my patients so that we can try and get lifestyle stuff adjusted and not keep throwing a pill at everything. Because did you know there are 5 different types of yeast? 3 of them will live in the vagina, and only 2 of them are actually cured with fluconazole or the pill or the diflucan. One of them, which so the most common type of candida is Candida albicans. Diflucan knocks that out, but Candida glabrata, which is the second most common kind, diflucan won't kill that. Right. So what kind of yeast do you have? I keep getting these yeast infections right because if you got Candida glabrata, the pill ain't gonna work for you. So actual doctor, what kind of yeast do I have? If they like, I mean, it's just regular yeast because they can do the test, the cheap test. It'll just say, oh yes, a similar sweatshirt is at Hollister. Go get it, y'all. Don't get it from Target. So they'll say, oh, you just have Candida, but it won't break down the different types of Candida. So I hate it, but the cream is called turconazole. So turconazole cream is going to treat people with Candida glabrata. So let's say you have been taking a pill, and you like, I can't get rid of whatever the case may be. Did you graduate from Warren Easton High School? No, I didn't. I graduated from Masterman High School in Philly. So if you keep getting it or whatever the case may be, then tell them, can you try some turconazole? Yeah, I don't really want to be on yeast cream for 4 nights, but I'm gonna need you. It may work for you. So anyway, I wanted to tell you guys. So here's a new product that I have with Clean and Cute. I ain't put the label on it because I just brought this home, this squirted for my house. So I'll be using all my products, but this is what it looks like. This is the atomizer. This is called the spray. Girl, this stuff smells like a spa day at the Ritz or at the St. Regis. If you've been there, you know what I mean. You know that fresh kind of perfume. It's just fresh. It is just fresh. I'm gonna get back to the Bartholin cyst because that's just too much medicine talk all at once. I need a break. It's for the back, it's for the bad beat, the funny smelling BBL girls. It is for the bad back wind. It is for coming out that bathroom stall. You don't know what you're leaving in there. It's for, you go in the bathroom at auntie house or his mama house, squirt, 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 leave the place better than you came, baby. It's for, the little, what do you call those things? Like the little chair cushion room spray. This is actually a beautiful linen spray. You feel like you're on vacation with this. Trust me. This is on the Clean and Cute page too. All right. So everybody's asking about my glasses. I get my glasses in one of 3 places. The real expensive place, but it's one of a kind. It is called Frame of Mind ATL. It's in Phipps Plaza. Miss Yvette is my girl. If you go, tell her I sent you. But like Dr. Rogers sent me over here. Miss Yvette, hook me up. Because sometimes I go in there like, I don't know, Miss Yvette. I'm looking for a different look. I don't know. And I always come out, now you're going to spend a check. But the thing is that it's one of a kind. So you're not going to, see 50 people with your glasses on. It's never going to happen. Not at Frame of Mind. You pay for it, but that's what happens. So when I'm like big time, and I just really want something, those little just frame of mind ATL. That's where you want to go. Online, I want to say on Instagram, I found this site, and um their quality of their glasses is pretty okay. It's Phytoo, Fytoo. I think I'm saying that right. But they have pretty cool glasses too. And then some of my glasses I get from Be Iconic. And it's BE and it's I like EYE, Be Iconic. And she's a black female with a site on Instagram. So those are generally the three places. Sometimes I'll pick up, if I see something at, like if I'm shopping and if it's one of a kind, sex type of thing. Sometimes I'll pick up sunglasses and then get them switched over to regular glasses and get my frame put on them if I like them enough. I think I did that with a pair of Loewe glasses, but so I'm just all over the place. I'm always just looking at something or for something that catches my attention. And I know that's how you guys sometimes find me on Instagram. So that's where my glasses are coming from, since you guys wanted to know that. Okay. Now, as far as the Bartholin's gland cyst, so the vagina is a very interesting place. We have glands all over the place, and a lot of these glands, you have glands up high, which are called skin. And when I say up high, think of like right here is the clitoris. So you have glands up high. I can't. This is crazy. Like Skene's glands, and then you have further glands down below, Bartholin's glands, and they all secrete like mucus into the vagina for when you need to get wet, you need to get lubricated. We're gonna talk about that too, because I got the trick. Baby, you better come in here and close the door because I'm about to tell you something, okay? Anyway, and so they secrete the glands, but sometimes the gland can get backed up. And then you start to develop a cyst, and it's called the Bartholin cyst. So when you do a Bartholin cyst, please guys, please don't ever go to anybody who's not a gynecologist. I know sometimes you get caught up on the weekends or whatever. If you got to go into the ER, and the ER will call down the gynecologist and be like, she got something going on down here. Do not go to anybody to touch your Bartholin's gland if they are not a gynecologist, because the Bartholin's gland is really interesting. It's like half of the cyst will be kind of like inside the wall of the vagina and inside the lip of the vagina. So it's kind of like in the hole a little bit, and the other half is on the outside. But when you open it up, you're supposed to open the side that's inside the vagina, not the side that's outside, because the skin is too thick on the lip. It's going to bleed like hell. You're not going to get to the cyst. It is going to be horrific. The pain is going to be horrific. Just please go to a gynecologist, okay? And sometimes they can come back because it's a cyst. So you open it up, but sometimes the wall can seal up. And if it's like, I'll be like, okay, 2 times. After the 3rd time, I'm like, okay, we need to do something about this. And then we call it a marsupialization. And so you take the cyst wall that's kind of like this, you open it up and you put 4 stitches and you kind of stitch it to the lip so that it heals open and so that the cyst does not come back. Okay. So that is how you handle it. It's not comfortable. Having a Bartholin's is horrific. You guys feel so much pressure. You can't walk. You can't move. Although it does not feel great for me to stick a needle in there with some lidocaine. When I pop it, you feel so much relief. And go from there. Sex after a pap. Child, you can have sex and you go home. I don't know what kind of paps you getting that you can't. Wait, on the no, girl, y'all. I guess I should have said this. This is not to be sprayed on your parts, okay? This is room spray. It is furniture spray. It is linen spray. So it takes up any smelly areas. Like, sometimes you might be, sitting somewhere with him and he go get something from the kitchen and you fart. Girl, get your spray out because it's small enough to be in your clutch. Get your spray out. You in his bathroom, you pee. Sometimes you pee, you let a little squirt out and it smell like you done doo-doo. Girl, but no, it is not for your body parts. It is for room, linen, all that kind of stuff. Because so I ain't judging nobody. Ooh, wait a minute, y'all. Oh my Jesus, what I done? Oh, hold up. Okay, Lord, I ain't judging nobody. But sometimes these people's sheets be stale and sweaty and all the things. And if you find yourself staying the night and the sheets ain't doing what they need to, just hit a little there. Just be like, oh, I can't go to sleep without this little smell. Help yourself out, child. Woo. But yeah, that's what that's for. But please don't go spraying nothing on your girly parts. We are not about perfuming things here. We're about fixing things. Okay. So yeah, I'm gonna need y'all not to do that. Just saying. All right. So there's that. But with the Bartholins, I hope that helps somebody. I hope that bless somebody and that bless y'all spirit. Now, another thing, I'm gonna put y'all on to something. Now, the thing is, this is so new for me. My bottle is even still closed. And you know, I'm a forever student. So I'm always learning. And y'all be getting on my nerves with this berberine and this inositol. First of all, don't get me started. Please go watch my PCOS video that's here on YouTube. PCOS has nothing to do with your ovaries. It is not a problem with your ovaries. Stop taking shit to strengthen your ovaries, because ain't nothing wrong with your ovaries if you got PCOS, point blank, period. Okay. But it is a form of insulin resistance. All right. So a lot of people are like, I can't take metformin. I don't want to take metformin. You ain't got to take metformin. But first of all, you're probably taking it wrong. Second of all, you're probably taking the wrong amount. Third of all, you're probably taking it the wrong way. And then fourth of all, nobody probably told you when you're taking it, you cannot eat carbs. You cannot eat carbs, or you will be on the toilet, or you will be nauseous. But that's another conversation for another day. Now, I want to talk about this supplement. Now, I'm going to need you to do your own research. I am not condoning. I am not supporting. I'm just telling you right now what I'm interested in and what I think I'm going to be trying within the next month or two. So I think that's going to be the move, right? Um, it is something called Yacon root. I think it's the extract, Yacon root extract. If you look this up, I want you guys to look this up, and if you can see it here, Instagram, but it's Yacon root extract. And it checks off all the boxes, y'all. It checks off all the boxes. It helps with blood pressure. It helps with blood sugar. It helps with appetite. It helps with weight. It helps with. I want y'all just to look it up and tell me what y'all think. I want y'all to tell me what y'all think. Okay. That's all I'm gonna say. I think it's that, girl. I don't know yet. It's only one capsule a day, but you take it with a meal. Like I tell people with the metformin, eat a little bit, take the medicine, eat a little bit more. And I'm gonna do this the same way. I'm gonna see. But yeah. So I'll let y'all know. I'll keep y'all updated on a subsequent live or one of my whatever, and I'll let y'all know. All right. So anyway, all right. So that's that. Now, another thing I want to talk to y'all about, this is we're coming up on maternal morbidity. Is it maternal mortality or maternal month? Okay. Any maternal health month. All right. I don't know if you guys know. I mean, because I can't assume that all of y'all follow me all the time, because y'all know how these algorithms are. And while I got y'all all in here, I want to make sure y'all know, if you see a video on Instagram, especially, I mean, on Instagram and YouTube, share it and like it, because they're not pushing out the constructive stuff all the time. And I want everybody to have access to this information. Okay. So now we're not gatekeeping around here. So go ahead on and share it when you see it. So for the people who is not on their algorithm, they are making sure that they're getting this information. Somebody asked me to hold this up again. It is, let me get closer, is Yacon root. Okay. And I think it's the extract or whatever. I read it. I kind of looked at the reviews. They had like 2,000 reviews. I didn't read all 2,000 of them, but I damn near came close. Because I don't know. It's my new fascination. It's the new thing I'm kind of getting on. And we will see. We'll see how it goes. Okay. I think it was 2,000 milligrams. Okay. And again, this is what I have in my possession. This is what I am going to do for the next few months. I can't say yay, nay, good, bad. So just something to consider. Okay. All right. So y'all listen, it is 9:00. I got to make my lamb chops and sit and catch up on my YouTubes and just chillax a little bit. I'm going to the hair salon tomorrow. If I didn't tell y'all, if I didn't tell y'all, so I'm a little anxious about that. So I gotta relax out a little bit. What I wanted to tell you about maternal morbidity and mortality month. I don't know if you guys know me. I can't assume that you all whatever. But did you guys know that I wrote a survival guide, a black woman's guide to surviving pregnancy, labor, and delivery? And so I say this from a space of, I give God all the glory. Let me start with that, okay? But I've done 7,000 plus deliveries. I don't deliver anymore. I've done 7,000 plus deliveries, and for the grace of God, no fatalities. And I have a special formula, and it's here. Okay. And I don't know, most of my kids are mentally gifted too. I don't know, y'all. That might have something to do with me. I don't know. But I had one that was in Mensa. Multiple of them speak multiple language. These kids are mentally gifted. I think it has something to do with the way but anyway, so this is it. This is what it looks like. I'm gonna bring it up to, can y'all see? This is what it looks like. It's a Black woman's guide to surviving pregnancy, labor, and delivery. And I literally take you through from trying to get pregnant, prior to pregnancy, what you're gonna leave alone, what you're gonna stop doing, what you're gonna do. In case y'all didn't see it up here, all the things, okay? And then I take you through the pregnancy, what tests you should have done, what information you need, what are the points of caution, what you should be doing. Stop paying for these damn maternity issues. No, you can pay what you want to pay. What you do, whatever you want to do with your money. But one of my things is that I'm trying to get implemented, and I work with Judge Hatchett. I was on a podcast of a friend of mine, Dr. Dave, with Judge Hatchett, and we said we were going to get together on some things. And it was before I wrote the survival guide, and we're going to try and touch bases with her. But one of the things that I recommend is that you have an attorney on retainer. Right. And the reason for that is, if you're in the hospital and things go to the left and nobody's listening and you feel like they're disregarding you, feel like your patient, your person, your loved one, you yourself are in a situation where it's dire, that's when you call that attorney to the bedside. When that attorney gets to the bedside, ain't nobody got nothing to say, because lawyers talk to lawyers, and baby, that risk management will be at their bedside. So if you weren't getting that attention you needed, you will be. So this right here walks you through everything, how your baby daddy ought not come up to labor and delivery smelling like weed, because what that's going to do is that's going to put a certain perception out there. They're going to start looking for stuff for you. They're going to start checking for stuff for baby. This thing right here, it gives it all to you. Top, bottom, left, right, how to do fetal kick counts, how to know when your baby is okay. And not the whole thing. Okay. So this is very important. You can find this on my personal website, is drtasharogers.com. My name, drtasharogers.com. I'm Dr. Tasha Rogers everywhere. So the .com is my website. You can find this and purchase this. And if you know a woman, if you love a woman, all of it is in my bio, yes. But if you know a woman, you love a woman, you care about a woman, you are a woman, you need this guide. Somebody said, well, can I use it if I'm not Black? Absolutely. But again, there are certain things that we know are very much experienced in the African American population, especially on labor and delivery. And I just wanted to make sure that you guys had a guide, a true guide that you can go through with information, with legitimate information, and with something that could potentially save your life. Okay. So I just wanted to get that out there, especially with May coming and maternal stuff. Everybody want to do this and want to say this and want to talk about this, but nobody really talks about what's really happening and why it's really happening. And so again, maybe that'll be a podcast that I do. And I think I've even done it before, but either way, I just wanted to make sure you guys knew that. So again, I'm going to get out of here. I want y'all to be able to have y'all Friday evenings. I need to make my dinner. It's awful late to be eating, but I'm going to do it. I'll make my dinner and chillax for the evening. So I'm so glad you joined me. Thank you so much. I appreciate y'all. Don't know how much I appreciate y'all. Y'all love hearing what I have to say, but I love that I can say it, and that there's an audience, and that there are people who are needing this information, and I am fulfilling the need and just trying to do God's work. And I love that for you, and I love that for me too. So thank you so much for joining, guys. And I don't know when I'm going live again, but what's today? Today's Friday. Monday, it'll be a new video up here on YouTube. And if you're on my Instagram, follow, swing over to YouTube, subscribe, make sure y'all got the notifications on so you'll know when I'm going all in, because I go all in. So thank you guys so much, and please have a safe and healthy weekend. And I love y'all. Bye. All right. Let me see if I can figure this out, how to end this thing. Yup. And then, yup. Okay.